and action. All right, you guys, Mr. Merlin here, Mr. M. And it's been about a month. We haven't done any videos. I've been working some crazy hours, but we've been getting some requests to do some videos. So today we're going to be doing T-spine, we'll be doing thoracic spine, we'll be doing 3 projections, we'll do the AP, we'll do the lateral, and we'll include the swimmers as well. So we're not going to do the oblique, but I'll explain the oblique to you guys at the end of the video, okay? All right, so let's go ahead and get started. All right, guys, so we have our patient here. Thank you for volunteering to be our patient. We're going to have you remove the glasses here. You just go ahead and set them off to the side. And we got him in the gown. He's removed everything above the waist. Opening the gown is going to go in the back. Make sure there's no jewelry around the neck, no piercings in this area. And we're going to have him go ahead and lie down on the table on his back. He's going to be in a supine position. We're going to have you put your head right over here, okay? We can do that. All right, watch your head as you lie down. Go ahead and slide down just a little bit. All right, so you want to give yourself enough room to where you can go ahead and get the receptor in that area. So I'm going to put that off to the side. I'll show you guys here. We've got a 14 by 17 flat panel detector. We're going to put it in lengthwise. And for my marker, I'm going to show you guys where I'm going to put the marker. So here's the middle of the receptor. I'm going to put it half of the half. I'm going to put it right here in this little area here, kind of in the middle. But I'm going to put it here because the spine's going to run along this way right here, okay? So that's where I'll put my marker. I'll close this up. I'll slide this over all the way. I'm going to slide him down just a little bit. I'm going to hit my X-ray light just here, collimation light. Okay, if we can dim the lights just a little bit, please. All right, there we go. So again, for the APT spine, you're going to put it in the middle of the T-spine, thoracic region. So how do we get there? Well, there's a couple different ways that we can do this. We can go ahead and place the receptor, the top of it, 1.5 to 2 inches above his shoulders. So I'll bring this down just a little bit. Okay. So here's his shoulders. If I put the top of the receptor 1.5 to 2 inches above his shoulders, right, that's going to put us pretty close to the middle of T7, right? Or if you want to, you can go ahead and find the jugular notch and then find the xiphoid process and go in the mid portion of that region right here. Okay, so it's going to be about right there. I'm going to look here to make sure that he's straight. I'm going to go ahead and go 17 inches in length. All right, so 17 inches in length and about maybe 6 inches in width. All right, so it's about the width of his neck, just a little bit more. I'm going to get this centered right over here. Okay. So again, I got the top of his shoulders here. This is about 1.5 inches above the top of his shoulder here. I'm going to come up just a little bit right there, and then I'll come up right here. There we go. So again, here's the jugular notch. Here's the xiphoid process. We're in the middle of those two portions. All right, so again, here's the jugular notch. His xiphoid process is right over here. We're going to go midpoint between those two regions. So again, the jugular notch is at the level of T2 to T3. So you know you're not going to cut off T1, which is going to be about this level right here. So again, your mid-sternum for this region, I have the marker, half of the half, which is going to be 1/4 of it, right in the middle here. Again, your T-spine is going to run along this portion here. So we're going to have him go ahead and, you know what, I like to bend the knees. Go ahead and bend the knees. I know it's not required. Go ahead and bend the knees all the way. I know you don't want to keep your shoes on the table, but it's okay. So this just helps to relieve some of the stress that the patient has on the lower back. It's not part of the position, but again, it'll keep the patient from being uncomfortable for too long a period of time. Okay, so again, we have the patient supine position. I got the mid-sagittal plane right in the middle right there. I have it at the level of T7. And we're ready to make the exposure. We have our technique set prior. We're at 74 kV at about 24 mass. All right, so again, he's pretty thin. So we got 74 kV at 24 mass. If it's a larger patient, you go to 30 mass at about 74, 76 kV, okay? So now we're gonna have the patient breathe in. We're gonna have you breathe out, all right? And don't breathe, hold it, and you're gonna take the x-ray. X-ray clear, beep. Then you're gonna tell the patient to breathe. So when you have the patient do an expiration, you get rid of some of the air, and this helps to make more of a uniform, dense radiographic image by having the patient breathe out as you do the AP, okay? All right, so now we're gonna go ahead and transition into a lateral. All right, so we're gonna have you turn on your left side facing that wall over here on that left side. You're gonna put your knees together, your hands together. You're gonna bend your knees, all right? Go ahead and put your hands together like this here. If you're playing patty cake, there you go. All right, so now notice we have him in a left lateral position. He is left lateral recumbent. So when he turned over, he didn't turn over all crazy. All right, so we're still pretty close to the level of T7. In fact, we're dead on it. So when they turn over on their side, you want to try to get them as close to the area of where you just left off, because now we don't have to do much work. In order to get a good lateral now, I want to show you a couple of things. We're going to make sure that the knees are bent, his hips are perpendicular, and his shoulders are perpendicular here. All right, so you can relax right here just like that. So now we're not going to get a lot of rotation. So you look at the shoulders, you look at the hips, you look at the knees. You want them to be perpendicular, okay? Now, the central ray is at the level of T7, but it's the posterior half of the mid-coronal plane. So what exactly does that mean? Come over here and I'll show you. So here is his coronal plane right here, and then we have the back. So what you need to do is you need to put it in the posterior half of the mid-coronal plane. So what I'm going to do is I'm going to push him forward just like this. There we go. Again, here is the mid-coronal plane. Here's his back. You want to be in the middle of those two portions. So in the textbook, it says to place the central ray at the level of T7 and the posterior half of the mid-coronal plane. So again, here's his mid-coronal plane. Here's his back. You want to be in the middle. Now, I don't know if you can see this, but we're cutting off some of the spine in the back here. So how do we fix that? Well, we got to open up the light field just a little bit. And that's fine. We can have it opened up here, and you want to make sure that you don't cut off this shadow right here in the back. I'm going to grab a lead strip so we can put this lead strip behind the patient here just like this. And do you remember we had our right marker here? I got to switch it up, and we're going to put the left marker. Now remember that the spine is going to come down at an angle like this. Remember, it has a kyphotic curve. It's a primary curve. It's going to come out like this. You see that? So I like to go ahead and put the marker here because the spine is going to come down like this. You see that area? That's my go-to. So when I close this up, my marker is going to end up right over here. And again, I put the left marker because, again, this is a left lateral. So now we're going to have you, sir, go ahead and breathe in, breathe out. All right. Oh, the technical factors. I'm going to make sure I mention that to you. So we're at 40 mass at 76 kV for this lateral. He's pretty thin. All right. So we got it set at 40 mass at 76 kV. All right. So now I'll go ahead and have you breathe in, let it out, and go ahead and don't breathe. Stay just like that. X-ray clear. Beep. Now, for this projection, you can do shallow breathing as well. So you can go ahead and do a breathing technique on this one. If you do a breathing technique, do you remember that's short, shallow breathing? You're using about a 3-second technique, and you're going to use maybe about 25 MA for 3 seconds. That's about 75 mass. But when you have a breathing technique, you're going to blur out the lungs and the ribs, and you'll get a really nice view of your thoracic spine. So T-spine can either be done, the lateral T-spine can be done in expiration, or it can be done on using a breathing technique. All right, so this is going to be your lateral. All right, now we're going to transition to the swimmers. What we're going to be doing is doing the swimmers now. So the swimmers, you're going to have to focus on C7, the vertebral prominence here. So he's already in a lateral position. So let me just show you what we're going to be doing. We're just going to drop him down over here just like this. All right, and let's see if we can get away with this. And I don't think we are. So guess what we're going to have to do? We're going to make a small adjustment, and we're going to slide you down right there, just like that. Okay, so I just kind of brought him down by his shoulders. You can get him to scoot down himself. We're going to put it back on C7 right here. So this is the vertebral prominence. And I'm going to go ahead, get that centered here. So what we're going to do is we're going to bring this arm down and back. This hand, you can actually use it to help hold your head up right there. There we go. Now you got more of a uniform parallel spine. We're going to center here at the level of C7. Now, do you see how the neck is coming down at an angle? We can go ahead and, you see this line, this long axis here? We could put that in the middle right here. But for the swimmers, we don't care about the rest of the spine. We're just focused on the lower portion. So we can actually collimate down. So I like to go to about the region of the gonian. That's going to be C3. And that's going to give me enough room where I'm going to get C7, T1, and some T2 in here. So take a look. His arm is down and it's back. This arm is up and it's forward. So now we're doing a swimmer's here, you guys. So let me go scoot forward just a little bit right there. Now, I like that much better. I could put my left marker here, or I can put it here in this region just like this. So I'll just do it here for right now. But this is going to be a swimmer's, and this is a left lateral swimmer's. We got our technique set at the same technical factors for the T-spine. We got it set at 40 mass at 74 kV. We're going to keep it the same because this is a thicker, denser region. And I'm going to have you breathe in, let it out, breathe in again, let it out, and hold it. Don't breathe, x-ray clear. Beep. So this is another projection where you can utilize the swimmers. Now, again, if he wasn't able to depress his shoulders, then you can use a 3 to 5 caudal angle here. So that can also be applied just like you would do for the C-spine. Now, again, this is a swimmer's projection. We can use the swimmers for the cervical thoracic region just to help us get the lower portion of the cervical and the upper portion of the T-spine, because you're not going to see that on a lateral T-spine. Now, we're going to go ahead and have you relax. So there's obliques as well. There's obliques, but those are very seldomly done. The obliques can be done at 70 degrees. If he's lying flat on the table, you would turn 70 degrees. So if we did an LPO, you would see the right zygapophyseal joint. If we did an RPO, you would see the left zygapophyseal joint. And that's going to be the elevated side. But again, oblique T-spine projections are very seldomly done, but we do get them on test questions. So we have to make sure what we understand, what we're seeing on the obliques. If he's in a lateral position, we have to go ahead and get to 70. So how do we do that? All laterals are at how many degrees? 90. So there's going to be a reduction of 20 degrees either side. So if he's in a lateral position, there's a reduction of 20 degrees just to get to 70 degrees. So again, if you do the lateral T-spine, you're going to see intervertebral foramina. But if you do the obliques of the T-spine, now you're going to see the Z joints. And you're going to see the side farthest away from the IR. And that's on your LPO and your RPO. So I hope this helps you guys. We got a couple more videos coming out. We're going to also be doing ribs, and we'll do some radiation protection. I got a couple of requests to do some radiation protection. All right, and that's it for today. Hello everyone, you guys. Thank you very much for watching the videos. I'm hoping that they're helping you out. Please make sure that you subscribe and that you hit the notification bell to be notified about new videos. Again, remember to be good to yourself and be good to others. Thank you.